Great question here regarding treatment, and it's kind of a multi-part question regarding how we're going to approach treating these cats both with immunosuppressants and the MSCs. The question was specifically with regard to cats that are clinically stable on those medications. How are we supposed to initiate the stem cells into the program? How do we taper these other medications? How do we determine whether or not there is improvement if we have these immunosuppressants on board? What do you say?
As we've moved on with our studies at Gallant, we've tried to mimic a much more real world situation. And so after our cats finished the 90-day study, they actually went on to a 365-day study where they were allowed to incorporate medications back in. And the main reason we did that was to see, like, how do the MSCs work with other drugs? Are there any safety or efficacy issues? And so the good news is we've got a lot of really great data from there that show that there doesn't seem to be any safety concern, of using steroids and cyclosporin with MSCs. And from some of the newer data we have, I can't release all of it, let the cat out of the bag yet, but what we're seeing in one of our newer studies where they were not required, to taper off the meds is they seem to do even better. So we think a lot of these drugs probably work synergistically, and there's certainly evidence for different indications in people and various other models that stem cells with steroids, stem cells with cyclosporin can work synergistically. And so what we would hope, obviously, we're treating this refractory population, is that if the cats need to be on cyclosporin or steroids either continuously or intermittently, but they're not, responding to be able to get off those meds and you're incorporating the MSCs in there, then eventually you'll hopefully be able to slowly taper off, those medications depending on how the cat is doing. And it doesn't have to be like a designated timeline, like you're in a hurry, you have to get this done at this certain time for us to be able to incorporate everything in. So just like Dr. Arce mentioned, like this is a disease that's very cat specific, right? Every cat is going to have their own specific cocktail, of what they need. And then similarly, if you've given MSCs, they take time to work. This isn't like a pain medication where, it starts blocking a pathway immediately, right? They're going to take time to modulate that environment. And so during that time period, if you have a cat that needs to be getting steroids intermittently or cyclosporin, then we do that. You know what I mean? We were able to see that with our long-term study that those things can be incorporated in. And what we did find is that for the cats that did need to have intermittent steroids or cyclosporin incorporated in, 75% of them were able to get all the way off of it, when we had given it more time. So we definitely don't want people to have to think of this as like an either or situation, right? These are medications we're going to use together, to try to combat this disease.
That's helpful. Thank you.